in Atmed Healthcare to welcome Dr. Kiren from GloClinic in Ananagar. He's a founder of GloClinic and he's been practicing for a long time there in aesthetics. And it's a very niche segment. And I thought we'd bring some, topics to light, especially for the youngsters and for elder people and a general public. So it's good to have you, Kiren, and seeing you after a long time.
Yes, very long time.
Yeah. Okay, so I'm just going to start on a few topics, right? So one of the topics I have in mind was aesthetics in dermatology, right? So would you say that it's already a component of dermatology, it comes along with dermatology, or is it something which they have created as a niche or a subtype now?
So aesthetics in India is not yet socially accepted. The term.
Okay.
Aesthetics all over the world is an accepted term.
Right.
It looks into cosmetic treatments more than clinical dermatology.
Okay.
So this is what we practice at the clinic.
Okay.
Of course, we do have a visiting consultant dermatologist there for other skin infections or any other diseases.
That's great. So you got to cover everything basically, and your line is more into this, aesthetics.
Aesthetics.
Right? Okay. So how has aesthetics become an integral part in dermatology? How do you feel it's become an integral part?
In terms of people's security, their looks. So everyone wants to do something to improve either their skin, their hair, health from within.
Yeah.
So that's how it gets correlated to each other.
Okay.
Of course, in terms of dermatology per se, there is your systemic or infectious diseases which a dermat would look into.
So you're saying it's more of self-care.
Yes.
That's where it has come to.
Yeah.
So you're saying there's an awareness in that. Actually, I think that's good. It's a good change.
Yes.
And would you say that this is transpired recently or over 10 years you're seeing a sudden change, or it's been there for quite some time?
It's been there for quite some time, but now people are more outspoken.
Okay. So what would you say the most popular non-surgical treatments are available for enhancing facial features and a bit of contours, right? So
you have treatments like your injectables like Botox, fillers, newer treatments like skin boosters, PDRN. You have your devices like Radiofrequency, HIFU.
Oh, okay. And can you tell me more about radiofrequency?
Radiofrequency uses heat energy
to
tighten the skin, whereas HIFU uses your ultrasound-based energy to help lift from the muscle area.
So when you say non-surgical treatment, you are mentioning something about heat therapy.
Yes, radiofrequency.
Yeah, radiofrequency. So in this heat therapy, won't a patient come and ask you, sir, tan
burn?
Will they ask you those
Yes,
questions?
people generally have that feeling that if you're using heat-based energy, could there be any side effect or a burn left on? Most of the devices, at least the FDA or US FDA approved devices, have energy controlled thermal energy.
Okay.
So the chances of burns or any side effects are very minimal compared to the devices which are unbranded, made in a factory in China or sold to people under the same pretenses of energy outputs.
So you're saying you should be careful with the brand you choose, but I don't know if a patient would ask that question when they come to the clinic. Do they ask questions like that? Other clinics, I know your approach is very straight. Like you should use this, and your protocol is very good. But would you? Probably this is a good platform to educate a patient and say, can you? You mean to say you can ask the doctor like what machine you use? Is it FDA approved? Can we go that far? Or?
Yes, nowadays people are much more educated on the devices available due to social media compared to a few years back. So they would just come and ask about the treatment without the name of the device you use. So nowadays, yes, more people are well informed on what they're getting done to their skin at least.
Okay, that's good. So I think over here we could bring that as an awareness that if the doctor suggests a certain treatment, they could do their own due diligence or homework on what that machine does and the type what they use, right? And ask the doctor. I don't think there's anything wrong in that.
Yeah, true.
Because I do know that even in joint replacements or even in cardiothoracic surgeries, the doctors do explain the processes of what they use, what metal
the brand
they use, the brand.
Yes.
So I'd say in aesthetics, they should do the same, and that's pretty good on your part to say that. But can you explain like treatments like Botox and fillers? It's actually something. I know it's a bit of a. I won't say it's a touchy subject because a lot of people use it, but I want to know more about what actually how this treatment goes about. And could you say its negative effects? Also, there must be everything has a side effect. Is my theory. Maybe I'm wrong, but can you tell me who it's for, who it's not for, and the do's and don'ts?
So Botox helps with your fine lines, wrinkles.
Okay.
Now people at a young age have started doing it. Moreover, it's for people generally around that 45 to 50 age group.
Okay.
That aging signs when they start showing. Side effects wise, minimal dosaging, maintenance therapies do help. Fillers are more for either your skin is dehydrated, you have one type of fillers for that. Under eye bags, hollowness, you have fillers for your cheek lift, lip fillers. So again, moderate amount of injections.
Okay.
Compared to overfilling an area.
Okay.
You could maintain this long term without having much of a side effect.
What are the side effects we should be concerned about, and who would you say should be concerned about that, if at all?
People who want to get over injected, they would be like, you use more ml to fill up the space, whereas it may not dissolve. You may get a bruise. Bruises, of course, are very common with any needle prick injury, which do heal. Of course, over injecting, sometimes the fluid doesn't get dissolved, so you get a lump in that area, which looks awkward. Again, even that can be dissolved by using a separate injection.
Got it. Would you advise somebody who's a little above 40, 45 to do it compared to somebody who's younger? Or what if somebody just came who was a little younger, like maybe even 25? They're like, no, I want to look like, I want certain things to change in my appearance. So what would you feel about that?
Generally, I would suggest younger age groups to try treatments like radiofrequency or MNRF, microneedling with radiofrequency, or any form of microneedling treatments which help stimulate collagen. Use skin boosters because they're much more hydrating. They're not going to require toxin at that age. Of course, above 40, 45, nowadays we do have patients who prefer non-injectables. Especially treatments like Botox or fillers. There is a group of patients, but we do have nowadays more patients willing to do little more less invasive treatments like your microneedling to help boost collagen for anti-aging purposes.
This sounds interesting. Now, if you say it's less invasive, can you define that?
You're not putting in something external back into your skin, whereas here you're injuring, like with microneedling as example, you're using an injury caused to your skin for your body to produce collagen to heal itself.
That's nice.
So it's a collagen induction therapy.
Is this painful?
Bare minimum pain.
Okay. Mosquito bite?
Yeah, mosquito bite. And bite.
Okay. Now I'm touching another topic, which is acne. Okay. It's a very common topic which is widely discussed about. What would you say the primary causes of acne are, and how do they affect each age group? So I mean I have some basic knowledge in this, but I would say let's go age group wise. Between maybe it starts at around 10.
Puberty.
Yeah, puberty.
Hormonal changes which happen. Then you have your 18 to 21.
Yeah.
Where it's a lot of junk food, makeup for women.
Okay.
Unhygienic conditions. People who work out, they don't notice that they need to wash their face or cleanse their skin immediately after.
Okay.
Then you have again your 21 to 30 where you have again hormonal, you have makeup, you have Instagram related skincare products, or people just trying out any new brand that comes out.
Okay.
And then you have your late 40s or mid 40s, which again go through that menopausal phase of hormonal imbalance. So hormonal is one key issue. lifestyle plays another big issue when it comes to acne.
Okay, so you're saying your intake is very important, your diet is very important.
Diet. There are few triggers like your dairy products, your oil, your spices, sugars, sweets. Not everything is going to trigger your acne. Probably you'll have to give like 1 week on milk or dairy, any dairy product to see if that's triggering.
Okay.
A week on sugar or sweets to see if that is triggering.
Okay.
So there are trigger food or liquids that try to trigger your acne in particular people.
Okay.
You need to figure out, or you stop everything, or at least get it under control where it's very limited on occasion basis.
Got it. But now suppose there's a patient who comes to you and has acne because of, I'll give you two instances. One instance is because of makeup, but they're not going to stop using it. What do you suggest for that?
Changing the brand in makeup.
That's
using a little bit water-based makeup.
Do they go for certain laser therapy or something to eliminate what is there?
So, see, acne is something like weight gain or weight loss.
Okay.
You either control it through lifestyle changes, if it is through that. Whether it's makeup, whether it's food, whether it's diet. Hormonal also, there are conditions where it is on you to change your lifestyle to make sure your hormones are well balanced. So, to treat acne at the clinic, yes, there are home care products that we do recommend. Okay. Or there are inclined treatments that help aid in treating or reducing the acne, but any trigger point which is there will again get you back probably after 6 months or after a year. So, the lifestyle plays a very big role when it comes to acne and its control.
Okay. So, instead of going like on the topic of makeup, instead of going in depth about what ingredient is not good, what is good, why don't we go to a neutral perspective, and what would you say a person should look out for in a brand which is good for their skin in makeup? It's like, I mean, for example, I don't know, this is my knowledge, for shampoo they say it's sulfur free or whatever, right? Something like that. What should you look out for in makeup? What, or something maybe natural, they say that this new whatever, I don't have no idea about this, but what
I have no idea.
Yeah, you have no
makeup, I have no idea.
Okay, that's good. Okay, we'll treat it after the problem comes.
Yeah.
Okay, perfect. At least you're honest about that. Okay, so let's go to, there's another actually important part in acne. That I think is probably the worst side effect, which people kind of regret later on, is the scarring. And that is quite important actually. How do we avoid the scarring, or how can we treat the scarring?
Now, some skins are more prone to scarring. Some people do get an acne, it subsides within 2-3 days, doesn't leave a mark. Some people get acne, it leaves a superficial pigment, and some people it leaves a pitted scar. So your superficial scars, there are superficial treatments like a chemical peels, laser toning. Whereas deeper scars, we prefer to do treatments like either injectables like PRP is an example, or you have laser resurfacing treatments like CO2, you have microneedling treatments.
Okay.
So there are a lot of microneedling with your radiofrequency. So a lot of treatments are there. You give them about 85 to 90% or 80 to 90% improvement.
That's good. It's a good number.
Because it's cosmetic, so you can't just say I'll give you 100% in anything that we do.
That's good. So I'm glad to know that there is actually a solution available for all the types of scars that occur with acne. So that's good. Actually, I have an interesting question for you. How do you differentiate between premature graying and actual graying? Like I've seen 20-year-olds also have like a lot of gray hair. Then I've seen 40-year-olds of have thick dark hair, but suddenly they get like a burst of it. Some people say caffeine can.
Yes.
Is this true? Does caffeine actually?
Caffeine is one of the main triggers.
Okay.
Again, poor multivitamin or food deficiencies.
Okay.
Vitamin-rich foods.
Okay.
Omega-3 can also be another thing that helps prevent premature graying. So mainly nowadays, lifestyle people eat a lot out. They have a lot of smoking, a lot of alcohol.
Right.
Black coffee has become a big thing. So these are signs that people at a younger age who have started tend to gray faster.
Got it. Okay, I'm guilty of black coffee myself, but you're right.
You're quite healthy, but
thanks. But my doubt in this was, how do you differentiate between the graying due to aging and the graying due to factors outside?
Okay, so factors outside are morely common.
The way it's pigmented? Or?
No, it's mostly people who are younger age group suddenly experiencing graying of hair.
Okay.
And then, of course, you have your elders like skin aging. You have above 40 people skin tend to age. So, again.
So, you're saying both, I mean...
Genetics also do play a role.
Both look-wise, I mean, say they
look the same.
Oh, they look the same, okay.
Hopefully, I'm right about this.
Okay. That's okay. So, let's go to anti-aging and skin maintenance. I think it's pretty important. What are the most non-surgical methods you use, or effective non-surgical methods used for anti-aging therapy?
One is injectables.
Okay.
You do laser devices based on energy-based devices like HIFU or radiofrequency.
Okay.
You do collagen induction therapies like microneedling or MNRF. And of course, your laser resurfacing treatments like CO2 laser.
Okay, CO2. Okay.
So these are treatments that can at least help you prolong the aging process as much as possible if done regularly.
Okay, so you're saying it's not a one-time solution?
No, it's a lifelong solution. Again, same diet and lifestyle plays a role in everything. Some form of exercise, some form of a good diet.
Okay.
So, of course, all these things prolong aging signs. You cannot stop it completely.
Okay. So you would say if your patient was to come to you and they take a certain treatment, you do recommend maintaining a good lifestyle also for it to have its actual results.
True.
Yeah. Okay, makes sense. Can you elaborate on some popular treatments like HIFU and Derma24, which I really have not heard of?
Okay. So HIFU is your non-surgical facelift, like ultrasound-based energy device to help lift the skin. So HIFU basically uses ultrasound-based energy to give you subtle changes in a facelift. More natural, more healthy.
Okay.
And it's done every year, basically between 9 months to a year and a half, long term again. Because your skin ages or sags every year, every 6 months. So you want to keep maintaining it by doing this treatment. Whereas Derma24 is a microneedling based device which helps with either active acne, your pigmentation, your acne scarring, and some amount of anti-aging by producing collagen.
Okay. How should someone in their 30s approach skin maintenance and somebody in their 50s approach skin maintenance?
I think it's the same.
Okay.
All age groups have a good day routine, have a good night routine, get some treatments to exfoliate or hydrate or produce collagen every 3 to 4 months to maintain the skin.
What did you mean by exfoliate?
Remove your dead skin either through treatments like facials. You have hydrofacial as one of the biggest known treatments to do that. You have chemical peels which help with this. So these are some of the treatments, or you use some kind of masks at home, or scrubs at home.
So I have a question when it comes to these chemical peels or masks you use, right? Is it possible that they could go a little too deep and then it could cause a tan later on, or is there any protocol such that after you do that kind of treatment you should not be exposed to sunlight or any UV rays out?
Yeah, there is a protocol post each procedure that's done that needs to be followed in order to prevent, like you said, basically burns or getting hyperpigmented.
Hyperpigmented, right?
Yes.
Yeah. So depending on the situation,
depending on the treatment, what they do, there are different treatments, different days, different set of products to be used on those particular days after the treatment is done. And how they look after their skin, like minimal sun exposure, minimal sweating, not much of hot water on their skin.
So would you say that these non-surgical procedures are almost as effective as surgical procedures?
No.
Oh, okay.
So surgery is a one-time, almost like you could say a one-time investment that you do. Whereas non-surgical, it is a lifelong improvement of the skin. Much more cost-effective for patients as well.
Okay, that's a good differentiation. So, what is your advice to maintain youthful skin as one ages? Let's say from 35 onwards. Or
diet and exercise.
Diet and exercise, right?
Of course, there is your skincare routine, your procedures, all that.
I think it's just diet and exercise.
Yeah, it is diet and exercise. Our parents, where they use product.
They never. No. So I've gone through myself. Okay. So one is like, when I go outdoors fishing and my hobbies, whatever it is, I've experienced a serious sunburn, and then I actually used to do this thing where I'd wear 2 masks and barely able to breathe. My friends would make fun of me over there, but actually that worked. My face would come out in a different way. Everything else would be like weird. But the thing is, some of my friends who got severe sunburns, it was like really bad. Like it'll be red. I would first see, I wouldn't see them get dark, but the redness would be there.
Yes, and slowly it'll turn to a darker skin.
It'll turn to dark. Yeah. Now, when they came back to normal, they came back to normal probably after 1 month. But would you say there's some percentage of damage done in that process, and do they need to see a dermatologist to make it?
Not really. There is, yes, of course, some damage, but basically prevention is better than treating the problem.
But my doubt is, after that extreme exposure, even for athletes and football players, whatever, after they get the tan, when they recover well, like they don't expose to sun after that. But do they get 100% recovery is my question, or is there some amount of damage which is done?
Depends. So some people do protect their skin. They do take oral sunscreens nowadays are there.
Oral sunscreen?
Yes.
Okay.
So they have
this is new to me. Okay.
So they are regular, but the possibility of getting some amount of sunburn depending on the prolonged exposure to sunlight is always going to be there.
Okay.
So one is you come back, you either go meet a doctor to get it treated.
So you're saying there's something like oral sunscreen. It's new to me. So could you go
So
on?
people who are outdoors basically, a lot of outdoor functions, a lot of outdoor activity, people who travel, a lot of sun exposure. See, everyone does apply topical sunscreen.
Yeah, that's what I
So now, the more you're exposed, so if you're out the whole day, every 3 to 4 hours you would want to keep reapplying sunscreen.
Okay.
Now this you're doing to your face or your neck. Now overall body is exposed where you would maybe apply some amount of topical sunscreen to your body parts which are exposed.
Yeah.
But when you're outdoors going on a trip, it's difficult for you to keep reapplying on your body every 4 hours. So some people do prefer taking oral sunscreen tablets to protect their skin as much as possible from sun exposure. At least the damage is much less with this protection than what it would be without the protection.
Correct. Are they safe to consume?
Yeah, they're safe. They're mostly antioxidants which are made into sunscreen.
Right. And they give you UV protection?
To an extent.
To an extent.
So you don't get
combinations better?
Yes.
Okay. So there's another tan which I experienced. One was with, like I said, sunlight and outdoors. I don't know, you must have seen this happen. Certain swimming pools. Like when I went swimming regularly, there was one place where it was like I got a bad tan. So I had another tan when I went swimming, and then they said it's because of the chlorine in the water. So is that like, can you recover from that, like how you go, like when you get sunlight exposure, or is that like almost a serious damage?
You can recover from all these. It's about treating it as soon as possible and not going back and not doing anything about it while getting back to the swimming pool.
That's what I wanted to ask you. So how would you're saying treating it. So if you the tan which you got in the swimming pool due to chlorine, what is the treatment for that?
So we give it a few days first for the skin to recover,
Okay.
become healthy, apply some moisturizers, get it back to healthy, and then whatever tan or pigment which is remaining on the skin, there are treatments to get it treated, or the topical creams depending on how severe the damage is or how fast someone wants to recover from it. There are in-clinic treatments as well as home care products which help reverse these effects. But again, treated earlier is better. The longer you wait or the longer you keep repeating the same mistake, it takes a longer period for it to get treated.
Got it. So I mean, we were trying to pull up some of the latest technology in aesthetics. And what is Aquacoal Therapy? How is it revolutionizing skin treatment?
So Aquacoal has come into India over the last 6 months. It is a very minimally invasive, minimal downtime treatment which involves microneedling, infusing a cocktail of serums. From person to person, you could tailor the cocktail, whether it is scarring, whether it's aging, whether it's skin hydration, whether it's pigmentation. You can make a customized cocktail of serums for each patient depending on their needs.
Nice. So these things, I mean, the serums which you the same thing you'd recommend, right? Like a good brand which is FDA approved.
Yeah, so Aquacoal microneedling is an FDA approved device from the US.
Very nice.
We do have our copies in India over the past 5 years. They have made the similar copies. Micro infusion needling devices.
Okay.
Where you do still have companies making it here with no patency. There's no FDA regulation to it. Of course, again, you don't know the quality of the needle used compared to what the FDA approved ones are. So when you get something needled into your skin, you want to make sure that the quality is the highest.
Is it really essential for you to be up to date with your latest technology and protocols in aesthetics, or would you say that instead of keep looking forward, kind of master what's there in the current scenario and then give it some time and then look for the next step, or what would your advice be?
This field, every month or every 2 months, there's something new coming up.
Exactly.
But they all are based on what was already there. Of course, small tweaks, small additions, small combinations are coming up, but it's nothing like something which has never been in this industry for maybe even a decade or two.
Okay.
So, but yes, you do need to know what are the new things out there in the market, whether it's in-clinic devices or whether it's home care products. They keep changing. You get new brands, you get better brands, you get brands marketed well. So you need to figure out what is working for your practice or for your patients and see what best you can improve it with what is there right now.
That's interesting. So what would be, would there be a scenario where a patient will come to you and say, I want this Aquacoal Therapy? Would they actually use the name and ask you that, or would it be like go to their problem and then ask you what's the best solution to it? Because I want to know what's the trend nowadays.
So over the past, I would say 1 or 2 years, people do come asking for the brand or the name of the treatment that they want.
Okay.
Some of them know what they want, but it's still they want to do a consultation, figure out what other options are there. But yes, majority of the people, due to Instagram or social media, do know what devices or new treatments available in our field. Sometimes the patients know more than the doctors.
It is possible, yeah. So my question in that would be, how do you balance that? I mean, I don't know, maybe this is a suggestion. If somebody comes to you, would you have a sheet or something prepared where these are the different types of treatment we offer for this problem, and then they can go read about it and then come back? Or
so basically we advise them what are the treatments available. Of course, there is always going to be cost in this field.
Yeah.
You cannot say that I have this treatment only at this clinic and I'm charging only this much when only a certain group of people could afford. So in the same treatment, as example of microneedling, it's good to have different devices at the clinic. Of course, the potency or the efficacy varies, but I do explain it to the patient who's there that the difference between this device to this device to device, why the pricing is different, and what is the expected outcome when you choose this, this, and this.
That's good. Could you tell me the role of brands and products in aesthetics? How much a difference does a brand make in this industry?
Now with skincare or hair care being the biggest market, in whether we say India or world, everyone wants to invest and make their own company or their own product or their own brand. So either you go with pharma companies, pharma science based products, of course worldwide known brands, than just everything that is socially marketed on either Facebook or Google or Instagram and claiming to do 100 things which even our pharmacy grade products cannot do. So of course, from my perspective at least, I look into companies who've always been there and well-known companies, imported products, the quality of the molecules are all good. Compared to, you can get a molecule of glycolic acid, example. It's a crystal. You can get a crystal for, say, as an example, 1 rupee. You can get a crystal for 10,000 rupees. So that's where a difference in say a product A and a product B costing 600 rupees and 12,000 rupees. It's where the molecules come from.
Yeah.
You can either get a cheaper quality molecule or you can get an expensive quality.
Got it. What should patients consider between choosing premium priced products and budget friendly products? What should they consider when it comes to these two? And is it possible that there are budget friendly products that actually deliver the same results as premium products?
If I say this, it'll look very bad. Basically, like it's like basically buying an LV shoe and wearing a Metro shoe.
Okay.
One is, some shoes are all comfortable. One is the brand that you wear, and the other one is just. So basically, it's patients' affordability and what they're looking for. Some patients, you cannot say, I cannot walk up to everyone and be like, you have to use only this product.
Yeah.
It is the best in the world, but it costs 15,000.
Yeah.
You have, at least in my clinic, I have lower middle class,
Yes.
I have middle class, and I have upper class.
Yeah.
So I need to know what product line at least is good, or what I could prescribe for each group of people.
So it makes sense, like, but you would say you can tailor make a treatment for an individual's need.
Yeah.
That's what you can do. So yeah, everyone has unique needs. There are some people who would want to, even spend more.
Yeah.
There'd be people who would want to be constrained on that and see the efficacy.
Yes.
Fine. So you can tailor make it for everyone. It was nice catching up with you here and getting to know more about your practice and the latest modalities. I mean, a lot of these things are new to me, but also I'm definitely going to consider a bit of care for myself before I jump into the swimming pool about fishing next time. And I mean, I would highly advise everyone to do the research, like what you said, and also take good precautions on the products you take, and take it to the doctor's advice. And it's a pleasure to have Kiren with us. So Dr. Kiren, and I hope we meet sometime again with some more topics.
Sure.
Thank you.